How is cogwheel rigidity related to Parkinson's? How is cogwheel rigidity related to Parkinson's disease? Cogwheel rigidity is a specific type of muscle stiffness that often appears in people with Parkinson's disease, a condition that affects movement. This rigidity is described as a ratchet-like or jerky resistance when a limb is moved passively, similar to how a cogwheel operates. When a healthcare provider gently moves a patient's limb, they may feel these intermittent catches or jerks instead of smooth motion. In Parkinson's disease, cogwheel rigidity occurs due to a combination of increased muscle tone and the presence of tremors in the affected muscles. The root cause of this is the loss of dopamine-producing neurons in the brain. Dopamine is a crucial neurotransmitter that helps regulate movement and coordination. When there is a deficiency of dopamine, it leads to increased muscle stiffness and involuntary tremors. Together, these factors create the characteristic ratchety movement seen in cogwheel rigidity. This form of rigidity can affect any limb, but it is most commonly observed in the arms. It often presents asymmetrically, meaning one side of the body may show more stiffness than the other. Cogwheel rigidity is one of the key motor symptoms of Parkinson's disease, alongside other symptoms like tremors and bradykinesia, which is the slowness of movement. Detecting cogwheel rigidity during a physical examination is important for healthcare providers, as it aids in diagnosing Parkinson's disease and tracking its progression. And like spasticity, which is another type of increased muscle tone, cogwheel rigidity does not depend on how fast or slow the limb is moved. The resistance remains consistent regardless of the speed of movement. Patients may find it uncomfortable or difficult to move their affected limbs fully, which can interfere with daily activities. While there is currently no cure for cogwheel rigidity, its symptoms can be managed. Medications that increase dopamine levels or mimic its action are often prescribed. Physical therapy can also help maintain mobility and reduce stiffness. Recognizing cogwheel rigidity early is crucial for timely diagnosis and effective management of Parkinson's disease. Understanding this symptom can empower patients and caregivers to seek appropriate medical advice and support.